This video is part 1 in our training series on the extreme importance of identifying and addressing nerve entrapments in a successful injury treatment process. In this video, I will be covering the causes, clinical presentations of nerve entrapments, and why they must be treated before any other structure in the body. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert, specifically for neck, shoulder, elbow, and wrist pain. My focus is on diagnosing and treating scar tissue and reducing inflammation from chronic injuries, which does lead to a significant increase in overall functioning and long-lasting pain relief. I'm also the creator of the PEAK method and the founder of the Soft Tissue Revolution, where we teach self-employed and overworked massage therapists a new treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid that dreaded burnout, and help more people get out of pain so they can stay the hell away from pain pills, injections, and surgeries, which only make things worse. All right, let's get right into the webinar. Nerve entrapments part 1, causes, clinical presentations, and importance of addressing first in injury treatments. So what is a nerve entrapment? It's really just a nerve getting stuck, and they really are a big deal that often get completely missed by injury practitioners across the board. Everybody misses them. Massage therapists, chiros, physical therapists, orthopedic surgeons, everybody misses them, but they are so important. They are such a big deal. And that's why I want to educate you through this webinar about identifying them and knowing they're there, because we got to fix them. Because if we don't address them, we're never going to have all the other treatments hold and get long-lasting results. So why do nerve entrapments happen in the first place? So over time, there's trauma to the area. There's two ways to get what I call scar tissue. Scar tissue is like glue, gets inside the muscles, makes it very weak and less flexible. So in a short term, basically what happens is muscles can get damaged in two ways. Basically, the first way they can get damaged is like an accident or trauma. That's like 10% of the time. The other one is just sustained contraction, bad postures, overworking, sitting too long, not moving enough, all of that. So over time, what happens is you don't get enough blood flow and enough oxygen into the muscle. That creates what's called hypoxia. When the hypoxia happens, it sends a signal to the brain, and the brain goes, oh shit, there must be some damage here. So it starts to lay down this scar tissue. Scar tissue, just like immature collagen fibers that form over time, starts to go in that area, and then it builds up like glue over time, making the muscle weaker and less flexible. So what happens over time is that scar tissue gets bigger and bigger and bigger, and then it spreads out. As it gets bigger and bigger, eventually what happens is it gets stuck to nerves. So nerves are actually supposed to make their way through the body and through muscles, and they have a lot of pathways where they need to go. Nerves are built with about 15% of extra slack to keep them healthy. Over time, as that scar tissue gets bigger, it eventually gets stuck to the nerve, and then you get that nerve entrapment, and it presents with a nerve entrapment. So what do they look like clinically? So what I want to include in this webinar is another webinar where I go through exactly clinically what a nerve entrapment looks like. And so you can figure it out and know that it's actually there in your own clients and your own patients. So I'm going to link that up right now. Nerve. Did you know that there are 256 different places in the body where a nerve entrapment can occur? That's a lot of places. Nerves have a long way to go. So basically, think of nerves in your body. They're like built with like extra slack. They got about 15% of extra slack because they have to make their way around joints, around blood vessels, through muscles, through fascia, and they got to have a little bit of extra stretch to them. But over time, as dysfunction forms, like especially in the muscles, and we'll get to that, as what's called scar tissue gets bigger and bigger, it's kind of like glue that gets inside the muscle, and it expands. And when it expands, it can actually cause that nerve to get stuck. So it'll start to pull and actually cause some symptoms in the nerve. And symptom location can give you a big idea too. So one thing I talked about, a lot of times in the upper arm, there's a lot of what's called peripheral nerve entrapments, and 3 nerves that get stuck in the upper arm are the median, the ulnar, and the radial nerve. And that's where I'll really dive in, where I'll ask the client, like they might say they feel some numbness or tingling, or some burning and some aching. And I'll ask them where they actually feel it. So if they're just like, yeah, I feel it here, I'll be like, can you really pinpoint it? Because one tells me radial nerve, one tells me median nerve, one tells me ulnar nerve, another one tells me if it's coming from the neck as well. The details actually do matter. Now, quality. Like I said, numbness, aching, burning, and tension. That screams to me a nerve entrapment. Provocative, a lot of times too, like once they actually start to use these muscles and these nerves and they start moving, they will feel it a lot more. Palliative, same thing, feels better when they lay down or if they lay off it, and causes that nerve to slacken a little bit. Sometimes they might feel a little bit better if they do some stretching, just because it frees that nerve up just a tiny bit. It is never long lasting, but it creates like a temporary effect in there. Now, before we go any further, I just want to clear something up that's really, really important. Whenever I share content or anything on the social media or YouTube, anywhere like that, I talk about nerves and why nerves are very important to identify when there's problems are there and actually treat them as well. And then I get a lot of people that are neuromuscular practitioners and they reach out to me as well. And they say, yeah, you got to respect the nervous system. You got to treat the nervous system first. But what they don't understand and what they think is actually going on is it's a wiring problem with the brain. But what's really going on is it's a problem out in the periphery and the nerve is getting stuck. So this guy here, this old man here that you see is 𝘠𝘠𝘠𝘠𝘠. He is basically the godfather of the neuromuscular treatments. And he has a great quote that says, respecting the approach of motor learning, any dysfunction in the periphery should be normalized first. So what is he saying? He's actually saying if there's nerve entrapments further down in the periphery, you must address them first. So the problem for neuromuscular people is they have it backwards. They think that everything is a motor problem where the brain just isn't working correctly. And if we get these muscles to fire better, we get them to turn on all this shit, that it's going to actually fix all the problem. But what they're not addressing is the problem further. They think it's a brain problem, but it's coming from further down. So yes, neuromuscular stuff can be important, but it's not motor learning. You don't need to like teach them how to move different. The glutes aren't just firing for a reason, or the muscle isn't tightening up. It's tightening up for a reason to protect the nerve entrapment in the periphery. So you must address that first. And that's what I'm going to teach over these next couple webinars, is where these nerve entrapments happen in the periphery. Because if you try to just fix the problem in the brain that's happening, but you don't address there, it's going to start all over again. So your neuromuscular people that reach out and you're like, yep, we just need to retrain all that. You're wrong. You're not actually getting to the root cause of what's going on, which is why you get temporary results. Yeah, the client might feel better for a day or two, but you ain't fixing shit. It ain't getting any better. So don't say to me that you're fixing the brain, because the brain ain't a problem. It's coming from further down. I'm done ranting. But I wanted you to understand that this is the OG. This is the guy that created all your stuff. And he literally said, you need to fix the problem in the periphery. And what he's talking about is nerve entrapments. And that's what I'm going to teach you and show you. So why must nerve entrapments be addressed first above everything else? I talk about in a lot of my webinars, there's 7 problems in the human body. There's a bone problem, there's a cartilage problem, there's a disc problem, there's a ligament problem, there's a nerve problem, there's a soft tissue problem, and there's a tendon problem. Those are the 7 potential problems that need to be addressed. But nerves need to be addressed first for a very specific reason. So the body has different hierarchies of things. And the number one thing the body must protect is your nervous system. So if your nerves don't work, you don't work. So if your nerve is getting stuck, maybe you have damage to the disc in the joint in the neck, or further down in the spine, it's going to put pressure on the spinal cord. So your body's going to sacrifice things to make sure that doesn't get bad. Because if your nervous system doesn't work, you don't work. So what it does is it sacrifices a lot of things around there: the bone, the cartilage, the ligaments, the fascia, the soft tissue, and the tendon, to get the pressure off of that area, and engages in what's called protective tension. So what is protective tension? It's basically if the nerve or an area is damaged and having issues, the body wants to get pressure off of there. It's kind of like the idea when you sprain your ankle, you know to limp. It's the same thing you neuromuscular people talk about, like, oh, the glutes aren't firing or the lower trap is inhibited. And it's for a reason, because there's other shit going on and you're not getting to the root cause of what's going on. Protective tension is your body's way of saying, hey, something's going on here. We need to protect it. So when your traps are tight, they're not just tight because they're fucking tight. They're tight for a reason, because they're trying to protect something. And a lot of times it's a deep underlying nerve entrapment. So if you do like an exercise or a stretch, or I don't know what else, you do some trigger point work or things like that, and they temporarily feel better, but you didn't fix anything, you actually expose that problem a lot worse. And it's going to be a bigger problem down the road, because it is a nerve entrapment in the first place. So how to properly treat nerve entrapments? Like I said, you got to treat them, and they actually have to be the first thing that you treat. Number 1, precise. Yeah. Slowing down, palpating, taking your time. So many of you are just in such a rush to get in there and just beat the shit out of stuff and see what happens. And you think, oh, it hurts like hell for the client, so it must be doing something. The next thing is you got to go real slow, precise first, then slow. What I teach in my system, in my treatment called the peak method, is getting proper depth, then proper tension, and then breaking that down. A lot of people look at it and they're like, oh, that looks like pin and stretch, or that's just myofascial release. It's not even close. It's so much different. It's on a different level than you can ever imagine because it's precise and it's very focused. The next thing is you don't want to over treat a nerve entrapment. You know, you beat the hell out of it for 30, 40 minutes, it's not going to heal up. And you think, oh, I'm getting in there and I'm breaking it down and the client's groaning and they're like, yeah, you're on it. No, all you're doing is jamming that nerve in there because you want to get it just right. You want to be gentle and you want to get that nerve to slide. So basically, if treatment is done right, you identify where that nerve entrapment is. Then what you do is you go just a little bit inferior to it. You get proper depth. Then you back out a little bit. Then you get tension into it. Then you have the client go through a full range of motion as you're applying tension. Tension is what breaks it down, not depth, not more pressure. And if you're using your elbow on areas where nerves entrapments are, you're a fucking jackass because that's actually giving more pressure and causing bigger problems. And you have no feedback with your elbow. So if you're someone that's jamming on people's traps or their sciatic nerve or somewhere in the body with your elbow, you're not feeling anything. You're way too compressive. You're not getting tissue slide. You're just beating up that tissue and making it a lot worse. And they might temporarily feel better because you stimulated some stuff, but you're making it worse in the long run. Got to be precise, focus, just the right amount. I always say nerve entrapments are like Goldilocks. You got to do just the right amount. If you do not enough, it's not effective. If you do too much, it's overly effective. You want to be right in that sweet spot. So what to expect going forward in this training series each week, for a total, I think I made 11 structures, nerve entrapments. Basically, I'm going to be focusing on upper extremity stuff. That's where my expertise more lies. So things in the neck, mid back, shoulder, elbow, arm, wrist. I'm going to be covering all of that. What we're going to include in each one of these webinar series is what the function of the nerve is, where and why this nerve specifically gets stuck, what type of injuries and symptoms it can present with, and some more tips and guidance how to effectively find and treat the area. And you can always do me a solid and help me spread this material. You know, the goal of what I created called the Soft Tissue Revolution is I just want to get better quality care to more people. And that quality care is quality hands-on soft tissue treatment. I believe massage therapists are the best at delivering it, but you need more refining, you need more focus, you need to think critically and figure out problems. And I want you to get away from the idea of being like a service provider where you just get paid for your time. You spend an hour, hour and a half, not really knowing what's going on, you're winging it and not really having a plan, to getting to more of what I call a solutions provider, where you know exactly what the problem is, you can communicate effectively to the client what's going on, and then you have a process and a system to know it is getting better. Anyone out there can teach you some bullshit techniques, but nobody teaches you a system. A system gives you repeatable, actionable results each and every time. So you can also, you know, share any insights you might have gotten in the comment section below from watching the video. Another thing you can do is just share this with other providers that you know it might help. And lastly, go and download our free training modules. We're always revamping them. And that one, we specifically teach you how to identify a common problem in the neck, specifically a disc and a nerve entrapment, and how to manage it correctly, find it, and even show you some treatment so you can get used to like solving one problem at a time and really building up that repertoire. See, I use that fancy word there to get you to that next level and start solving problems. I appreciate you guys watching this one, and be sure to be on the lookout for the next ones coming up, and we'll see you guys on the next one. Bye.